Good evening, Franklin Township. Welcome to the December 23rd, Christmas Eve edition of the Franklin Reporter and Advocate News Hour. I'm your co-host, Bill Bowman.
I'm the other co-host. I'm PJ Parker. Welcome, Franklin.
And we are co-publishers of the Franklin Reporter and Advocate news site and newspaper and morning report and all the other things that we do. So this evening, we have a very timely program for you. We're going to be joined in a couple of minutes by Mayor Phil Kramer, who maybe you don't know, is also a doctor. He's Dr. Phil Kramer. We are going to be talking about CDC guidelines and other health department guidelines for what are inevitably going to be holiday gatherings the next few days and next week, actually. You may or may not know that Dr. Kramer has been a tireless advocate for safety in the age of COVID. He's always advocating wearing masks, washing hands, limiting your exposure to other people. In fact, back in March, he was really annoying with telling people not to touch their faces, not to touch their eyes and stuff like that. But as it turns out, it was necessary annoyance.
Correct.
Yeah.
He was absolutely correct.
Yeah. So we're going to be joined by him. Paige, any thoughts preliminarily?
Preliminarily is that Phil Kramer, not only as a physician, as the mayor of Franklin Township, he has tirelessly every single day been posting facts and figures and caseloads and the age demographics and the demographics of results, and he's tirelessly been informing this community about what Franklin's status is in this COVID pandemic
on a daily basis.
And every single day that somebody, if you don't read it, that's a shame, because it's your profile of your backyard, Franklin. And there have been frequent comments, but I think a lot of people just, they're not seeing what the statistics are. So we'll explore some of that.
Cool. Let's bring it on.
Whether people read it or they don't read it, it's there. It's for your benefit, Franklin, to know where you stand and where others in your community stand.
Correct.
In terms of COVID.
Let's bring on Mayor Dr. Phil Kramer. I don't know which is first. Hello, Mayor Dr. Kramer.
Hello, how are you?
Welcome to the News Hour. Is it Mayor Doctor or Dr. Mayor? What's the protocol? Do you know?
Well, you would say Mr. President, so I would say Dr. Mayor.
Dr. Mayor. Okay.
Okay, good enough.
Although the mayor of East Brunswick calls himself Mayor Cohen, MD.
Mayor Cohen, MD.
That's interesting.
He's also a doctor. We think there's 4 or 5 of us.
4 or 5 mayor doctors in New Jersey?
Yeah.
That's interesting. You should form a little club.
As a doctor, man.
Little social distancing club. And you're actually a medical doctor. You're not a PhD doctor.
Correct.
We need to, I guess, and these days we need to differentiate that. I don't know why, but all right. So actually, right before we brought you on, I don't know if you could hear us or not, but right before we brought you on, we were talking quickly about what you've been doing on a daily basis with the numbers that have been coming out from the county health department about the number of new positive tests, and thankfully not since November 10th, the number of COVID-related deaths of Franklin folks. Now, you also break those numbers down. So talk a little bit about that, about how you do that and why you started doing that.
You mean by age?
Well, however it is you do it. Yeah, the charts that you make and whatnot.
Mm-hmm. Yeah, most recently, it has been broken down by demographic, and I do want to explore that because it's in a framework that I think most people are not realizing, that it's not just ages 70 and above who are being affected by this. That seems to be only maybe 25% of the caseload. But please let us know what's going on in your methodology.
Can I share my screen? It'd be easier if I did it that way.
Give it a shot. This is a brand new format, Frank, where we were doing this with Zoom in the past. We've now gone to another third party. So this is only the second time we've done this, so everything's new.
But thus far, if you do have comments, it can be, the comment may be seen, and if it's seen in time, we can respond to it.
I'm working.
While the mayor's doing that, I just want to mention that I'm wearing my beige shirt my beige Franklin Reporter Advocate shirt as a special favor to a dear friend who requested it last time.
Yes, I know.
So is it shared?
Your chart is not up
Wait a
yet.
second. Hold on a sec. There you go.
There we are. Okay.
All right,
Oh.
so that's at first it looks like a very complicated chart, but what you do is you read it vertically. So at any one time, say on April 30th, you go vertically and you reference the colors here. There's very little people 0 to 4 years old, 5 to 10 years old, a little hint of 11 to 18-year-olds by a little bit of green there. And then you start to see 19 to 30, bigger of 31 through 40, bigger 41 through 50, then 51, and then over 60. And this particular one shows you also the total number in comparison to a peak that we had on April 30th. This also looks over the past 30 days from the date I referenced.
Mm-hmm.
So you get a bunch of information here. For one thing is you can see the relative peaks that we had a lot back in April. It died off during the summer, little bump in September, maybe Labor Day, I don't know. And then we're climbing up again. And you can see the age distribution. Right now, clearly the 19 through 30s, the 20-year-olds are taking up the biggest chunk, but you can see the 61, well, the over 60 group is gaining in size too. So that's a little bit concerning because, of course, they're more susceptible. So that's one of the ways I break it down by age demographics.
Mm-hmm.
And well, let me bring this back to the forefront here so I can look at it. So yeah, again, it's not really affecting the younger kids, right? 0 to 4. Or is wait, no, what is that? Look, that's the blue.
That's the blue at the very bottom.
The very
Bottom, right?
teal.
Okay.
The biggest growing group is our 20-year-olds, 19 through 30. I picked these ages because 0 through 4 tend to not transmit the virus to others very much.
Mm-hmm.
5 through 10 do transmit it, but they tend to be very unlikely to get disease. And then 11 through 18 are the rest of the school-age kids.
Right.
So this was kind of something that could be used by the schools to figure out what's going on. And there is somewhat of an increase since late October of the school-age infections.
Well, that sort of makes sense, wouldn't it?
Yeah. Although there's been, it gets complicated. Medicine, it can be very complicated. Some of the people believe that with the kids in school, they're under tighter restrictions and they're in a controlled environment, are less likely to spread than when they're home and not on, their remote learning, then they tend to gather anyway. I said, oh no, they're home alone. And Dr. Ravalli kind of giggled at me saying, well, that would be a poor assumption on your part. They find a way, especially if their parents are working and they're home alone.
Right.
So I don't know that being in school makes the kids spread it more.
Mm-hmm.
I guess this graph would imply it does. But it's also maybe parents are more aware and getting them tested more frequently.
Yeah, yeah. What do you think accounts for that growth in was it 19 to? Can't see it very well. 19 to 19 to 30 people. Yeah. What do you think accounts for that?
So I have no data.
Okay.
Let's see if I can. I have no data, so it's pure speculation.
Mhm.
I would say it's behavior.
Okay, well, can we explore that a little bit? I think Franklin, where can people see this chart that they can study it a little bit more? Because I think people just want to know what your thoughts are about this and what your medical uh, criteria is, or your medical analysis of what these numbers are showing.
So I post it from time to time, no particular schedule to it. Um, I can't remember when I posted it last, but within the last week or so, I posted occasionally. I mean, this is just my own calculations at home.
Mm-hmm.
Um, and when there's a significant change, I post it,
Mm-hmm.
or if there's a point to be made, I post it.
Mm-hmm.
It takes quite a bit of time to do all that, and I have to bug my wife because it gets put up on mayorkramer.com, and you can. So that's one thing you could do is go to mayorkramer.com and look at. It's usually posted with the when I have a PDF. If you see a PDF of today's cases,
Mm-hmm.
usually if there's a PDF, that's because I posted a graph of some kind.
Mm-hmm.
I mean, one of the other graphs that I've been posting lately is these. Let's see these. If you look from day to day, um, you know how many cases per day, you can get lost because there's a spike here, a spike there. So I just to look at it, and we'll just zoom in on the cases first. So if you look, we have our big spike in April, and then
Really?
it calmed down, and the summer was relatively low. These
Mm-hmm.
are cases, total cases in the month. December now, however, we've gotten 610 cases so far. It's obviously only the 23rd. So if you do a little bit of math, it's looking like we're gonna get 822.
Mm-hmm.
That's a straight linear projection. That's just math. There's no science
All right.
in that. And
Well, there's no evidence of it yet because we're not at the end of the month yet.
right.
Right.
So, but that's basically on par with April. The
Okay.
interesting thing, however, is as you mentioned before, um, or maybe it was when we chatted just before we went on,
Yeah.
there have been no deaths for 43 days reported in Franklin from COVID.
Interesting.
And so we've
Very
had
interesting.
more cases, but no deaths, um, thankfully.
What do you think that is attributed to?
Yeah, that's really hard to tell. I mean, they're talking about variants now on television, the England variant and
Mm-hmm.
the African variant. Um, Viruses, uh, in evolution wise, don't want to kill you. What is any living replicating thing? Well, the viruses aren't living. What does any replicating thing want to do? It wants to replicate more. That's the whole idea of evolution is if you replicate more, you win. And if you replicate to replicate and live and exist long enough to replicate again, you win. So there's no advantage to killing you to the virus. The advantage is to be as contagious as possible and to spread as much as possible. There's not even an advantage to making you sick.
Mm.
Mm-hmm.
The best thing the virus could do for itself would be to never make you sick and be very contagious and just spread and spread and spread and spread. There's a book called The Selfish Gene, if you want to learn more about it. Very interesting.
It almost sounds like there's an intelligence to the molecular structure.
There's the physics and statistics and biological advantage. I don't think it's an intelligence. Viruses aren't even alive. But I see what you're
Exactly.
saying. I see what you're saying.
Yeah.
So there's an advantage to the virus to not be lethal. So it could be that the virus is mutating to be less lethal. I doubt that, only because we see there's surveillance out there for um, for mutations, and we haven't heard about this yet.
Mhm.
Um, it's also interesting. Deaths are going up in other parts of the country, and they're going down here in. Last time I looked, in all the town, the county, and the state, death percentages,
Mhm.
percentage of people who die who get infected are going down in all those district areas. And it just may be because we've modified our behavior,
Yeah.
or because, and by that, older, more susceptible people are staying home, and younger people are out there getting it and spreading it to each other. So that makes the numbers go up without the deaths. Could also be that we're getting better in the hospitals
Hmm.
at
Mhm.
treating them. So, um, and it's interesting though, at other parts of the country, that's not happening. The deaths are climbing.
Wow.
So,
Well,
uh,
there are variables that I understand that this virus will mutate ever so slightly from person to person, so that its measurement is going to be different. If you caught it or I caught it, it's theoretically and fundamentally the Corona 19 or the COVID-19 virus, but it's going to have a variation from person to person. And that's, I'm guessing as a layperson medically, that it makes it that much more difficult to corral it and to figure out exactly what is going to stem it and eradicate it, because it's just every single person has a different interpretation physiologically.
I wouldn't say every person has a different one, but it's expected to mutate. It's an RNA virus, and the thing about RNA, if you remember, DNA is a double-stranded molecule, and so one strand, it's like a key in a lock, or one strand matches the other. It's like a photo and a negative.
Hmm.
They match each other. So if you get an error in the photo, the negative could correct it.
Hmm.
Um, with a single-stranded molecule, if you get an error, there's nothing to correct. There's no check against that error. So RNA viruses mutate faster than DNA viruses.
Hmm.
So the mutation is expected. Um, no one, no scientist is surprised that we're getting mutations.
Hmm. Interesting. All right.
I think
Okay.
one of the things that I see you emphasizing all the time, and since this began, your constant mandating of people's thought process that every person you encounter, you must think that they have this virus and protect yourself and protect the next person. And I think that's been one of the most valuable things that you could say. Just assume that everyone has it so that you take precautions and the next person takes precautions.
Yeah, I'm gonna pick on my poor wife here. Early on, someone came over and handed her something, and I said to her, "Would you have gotten that close if you knew that
Exactly.
she had the virus?" And she said, "No." I said,
Hmm.
"How do you know she didn't?"
Hmm.
So that is my basic assumption: is I assume everyone I encounter
Hmm.
has the virus.
Well, that's interesting. We just spoke at length to Joe Danielson, State Assemblyman Joe Danielson, the other day, and it's public knowledge now. I'm sure he won't mind my sharing this, that he and his wife Christine are still both dealing with COVID, and Joe was one of the most vocal, vociferous proponents of wearing the mask and social distancing and doing the right thing and getting tested, and it took one instance where he said, I was careless. I let somebody come into my house and I didn't enforce him wearing the mask. I had a mask on, my family had masks on. He didn't. When he left my home, 3 hours later, he called to say, look, I've got symptoms. I was tested positive. And that's what affected the Danielsons. One person who was infected.
Yeah, I commonly hear people who had dinner with someone else and they say, Oh, but they're really careful, so it's okay.
It's you're making excuses
Yeah,
that you can't make. You want to because you want to be charitable. You don't want to think that, oh, that person who I'm close to is going to make me sick.
Right.
It's not a judgment; it's a reality.
we all make mistakes. I mean, I've made mistakes and walked away and said, "Oh, I hope that that person didn't have it, or they probably didn't have it afterwards." But
Hmm.
that's trying to make myself feel okay about something I did that I without thinking. But when I
Right.
think about it, I don't do. No one has been in our home since March, whatever, except when our refrigerator broke. The two guys who carried in the new refrigerator and
Mm.
carried out the old one. Those are the
Mhm.
only people, and we were masked and we stayed away from them. And
Good.
so,
Well, that's a good, excuse me. Oh, just one real quick second here. I just want to, Richie, I wore it just for you. Um,
And just, I don't know if he can hear me, but guess what? He has many of them. It's not the exact same shirt every time. In case you were wondering about his laundering habits.
yeah, really.
just like Superman, there's many
Exactly.
super suits.
I'm exactly like Superman. You're right.
It
Anyway,
just cracks me up that that's the only thing he's getting out of this. So I don't know why he's even bothering just to listen.
really. That's
Anyway,
a good segue into the main thing we wanted to talk about, which is the gatherings that are probably going to happen over the next week or so. So, Mayor, tell us. You know what I want to do real quick? I want to share something as well. Just bear with me for a second as I bring it up, if I even can. Well, it doesn't look like I can. Okay, not a big deal. It was, or maybe I can't. Hang on just one sec.
well, while you're adjusting, Mayor Kramer, what would your advice be to people who are thinking, well, it's Christmas. We want to do this. We want to be with them. What's your advice? I mean, I know what it's going to be, but I think we have to hear it.
I get it. I just did my letter to the editor. Delayed gratification.
Yes, and
I'd
gratitude,
rather spend
empathy. Right.
I'd rather spend the next 10 holidays with my loved one than spend this one and then not have them around for the next 10.
That's
Um,
almost a shocking statement.
if you have to do it, meet them outside for a short time. Wear masks. Don't hug. Say hello. I don't even like exchanging items. Although the CDC says that there isn't much that this isn't a fomite. A fomite is an object which passes a disease. This isn't that much of a fomite disease, but I
what
still
disease?
fomite. Fomite is a medical term for an object that will pass a disease. So, like, the kid is sick and he hugs his teddy bear, he gives the teddy bear to another kid.
So it's an inanimate object or fabric.
Yes. So they say CDC says fomites don't spread the disease very much. I'm still very, very careful with things. I get a package, it sits around for a couple of days before I touch it. So even exchanging gifts has its risks.
Well, that's going to, I think, exacerbate what the numbers were for Thanksgiving. Thanksgiving was not a gift exchange. Christmas is going to be.
You have to gather, have the meal at home, and then gather there, open the windows.
Right.
There's ways to do it if you have to do it. First is don't. Zoom, Zooming. We had a Zoom Thanksgiving, and it was actually quite sweet.
Hmm.
I mean, I like it, but you know what? I didn't have to drive home. That was okay. Um,
Well, I love your thought that better to be prudent for one holiday than to be missing a loved one for many to follow.
Yeah.
I think that really touched me.
Yeah.
I think that's wonderful advice. We can see now that we're in the middle of a spike in the numbers nationwide because of Thanksgiving, because of those gatherings, and the potential for Christmas. There's as much sentimentality involved in that holiday, and church services. I don't know how many people attended church on Thanksgiving, but there are Christmas Eve services that are going to be live. Many will be virtual, but many going to be live. And although I've seen in several religious institutions, houses of worship, that distancing is absolutely enforced, and it's a 6-foot marking separating areas. So it does cut down, but it doesn't cut out.
Right. Right. I just wanted to point out that that thing I was scrolling before was the online CDC recommendations for holiday gatherings, and you can see it is voluminous.
Mm-hmm.
I mean, it's, and then that's not it. There are links to more information about on their recommendations. So I think I don't know. I think that the cliff notes are basically just stay home.
Right. The simplest advice
Yeah.
that you, Mayor Kramer, have been talking about since the beginning. And so many people may not be telling you to your face, but we hear it. Others hear it, that you've done such a wonderful service for this community and keeping people informed, whether they want it to be or not. The figures are there. The facts are there for people to take and absorb them. And you've provided them. No one else is doing that.
Yeah. Yeah.
well, and I get people's frustrations. Today, a woman called because her recycling hadn't been picked up for a couple of weeks, and she was incredibly upset by it, out of proportionally upset by it. And our manager um, just felt that she was so upset. He called her, and she hung up on him, and he actually drove out to her house to tell her, "Look, I've arranged for them to come, and they've missed a few places. They're going to come around and pick it up. I about your recycling, so that I don't want you to miss that opportunity." And she apologized profusely and said she'd had a bad day. But and he said she was an incredibly nice woman. But I just think that little things are bringing us to the edge. It's been a
Exactly.
long time, and we need to be kind to each other.
Yeah.
We really do. There's, the last years in politics, it's been, and it's kind of, it's almost become part of our culture. Being rude and hostile is almost,
Defensive. Mm.
and this is just not the time for it. We need to forgive. I made a promise to myself in March or April that I am not going to hold a grudge for COVID related things. That I'm going to um, find a way to forgive. And I've had some arguments with people at work who were not respecting my space,
Hmm.
and
Wow.
I convinced them to respect my space, but I'm not angry with them for doing it as
And
long as they do it.
this is in a hospital.
Yeah,
Wow.
it's initially there was a problem. Now with the second wave, people are getting it. We're getting stricter with our rules.
Hmm.
Um, I understand from now on, you have to wear N95s in clinical areas,
Mm-hmm.
not just surgical masks. I'm on vacation now, so I heard that secondhand through people. But they did mask fittings, etc.
What makes the N95 more protective?
It's actually, there's a YouTube video on N95. There's a lot of science with it. It's not just a filter. Like the holes, they make the holes small enough so that the virus can't get through. There's a little bit of that, but the virus, none of the holes are so small the virus can't get through. There's materials that attract the virus in there, so the virus gets trapped in the mask. There's actually quite a bit of engineering to it, but they are more protective than the surgical mask. They have less leak around them too.
Right, they're more form-fitting. Right.
So let's get back to the holiday gathering issue topic. Do you have any tips, Mayor, for folks? They're going to meet with it. They're going to get their families together. It's Christmas, doggone it, and no one's going to take Christmas away from me. But anything that people should be doing in the house, just to try and limit whatever exposure they may otherwise be opening themselves up to.
Well, PJ just obviously signaled wash your hands frequently. The shorter the time, the farther you are apart, the more fresh air, the more you wear masks. I mean, do you really have to have that meal together? Zoom the meal and then meet. And if you can meet outside, that would be great. Just don't be in a closed room face to face with people without a mask.
Without a mask.
Without a
There's your
mask,
key.
yeah. Gotta have a
There's
mask.
the key. Absolutely.
I read, just skimming that CDC document, one of the things was have people bring food rather than have it be a potluck or a buffet. But if you're going to have a buffet kind of a thing, limit the people to like maybe one or two who's actually serving the food, so you don't have a whole lot of hands on the serving utensils.
Exactly. Or have one person, host or hostess, doing the serving. So there's one set of hands, possibly gloved, who are doing all the serving and handling of the utensils. That I would think that's a common sense.
Right.
approach.
So we have a comment from Laura Smith, who did a nice segue for us. Thank you, Laura Smith. Mayor Kramer should talk about the importance of getting the vaccine.
Yeah.
We have two vaccines that have been distributed. We have the Moderna vaccine. We have the Pfizer vaccine. I understand that once the school district gets its approval for its plan, it's probably going to be inoculating its staff with the Moderna vaccine. So can you give us, well, I sort of stepped on you there, Mayor. So go ahead and tell me what tell us what you were going to say.
Well, first of all, get it. If I had the opportunity to get it right now on camera without stepping in line and cutting in line, I would absolutely do it. My sister actually got her vaccine today, her first shot today, and I'm jealous. My wife said, "Yay!" and I said, my wife's a better man than I. I said, I'm jealous, and I'm probably in line to get it by mid-January or the end of January, and I'm really sad that my wife's going to have to wait. She's under 65. She has no particular diseases that make her more vulnerable. So she's going to be, kind of in that, general group. And,
but you're in a hospital environment. I
I'm in
would
the
think you're
hospital.
going to be the first, one of the first ones.
And there's also a consideration that as an elected official, because unless we have a council meeting, you can't pay your bills.
Right.
But to say we're essential, I'm like 5/9 of essential as a mayor, because if 5 of us are okay to meet, then we can pay our bills. So I don't know that as an elected official I'm essential, but I do work in a hospital, so I will be somewhere in line, and absolutely I would without hesitation I would get it. Is there some risk? Well, there's risk of the flu shot. I'm not going to, I try to tell the truth. Of course, there is risk. Every medicine has a risk to it. Penicillin, you can die from penicillin. You can get an allergic reaction. I have gagged maybe 2 times as in my medical career. It's something that came before me. There's something called Stevens-Johnson reaction, which is an extreme allergic reaction. I won't go into the details. I was about to, but I won't. And when I saw someone with it, I actually gagged.
Wow.
So that's from penicillin. So antibiotic, and I say penicillin, antibiotics have that ability, and probably everyone watching here has had an antibiotic at a time and they did it without thinking about it. So I absolutely would get this vaccine.
Well, an antibiotic has somewhat of a predictable nature at this point, that its action is able to be quantified and verified, whereas the vaccine, much like the virus, is not quantifiable yet. There are no hard and fast possibilities of side effects. I mean, when one thinks, and you and I've had this discussion about, wow, who's going to actually want to inject themselves with coronavirus, which is typically what you think of a vaccination, that you are injected with the actual substance. And I know you've said that that's not true.
Whoa, yeah. So I raised my hand because I want to be injected with the vaccine. So the Moderna and the Pfizer vaccines, you are not getting the virus. So the original vaccine was for smallpox, and what they would do is give you a little bit of smallpox and a scratch, that small infection would allow you to build up antibodies before it could take over fast enough. People got sick and some people died for this. With the Moderna and the Pfizer vaccine, there is zero chance of you getting the virus from it. I mean, you could get it from the person injecting you, or the person
but not from the
lying next to,
substance.
but not from the substance itself, because
Would you
they are
please
not.
say that again? Please say that again.
It's impossible to get the virus from the vaccine itself, because they are not giving you. They're not even giving you a piece of the virus. They're giving you the instructions to make, so that your body will make a piece of the virus and then grow antibodies to it. But it's a small, specific piece. That piece itself cannot hurt you. It is impossible to get the virus from those. Now, the other vaccines that have come out, that may be different for those. I don't know, and I don't know the details about those other vaccines. But for these two, it's impossible to get it. And the interesting thing, we've heard about these mutations. They can plug in the mutation very quickly in this. This is almost like running a computer program. In fact, I'm sure they use computer programs to create this vaccine. It's a very clever platform that they're using, which is 10 years old, but the first time it's being used in this way. And that's why they were able to do it so quickly. But it is impossible to get the virus from the vaccine.
I think that is the most important thing that you could say about that right now, to allay the fears of those who have said there's no way. The other thing, if you could explain what the chief differences are between the Pfizer vaccine and the Moderna. The ones that I'm aware of is that the Pfizer vaccine has to be refrigerated at extraordinarily low temperatures and is also advised for a different age grouping than the Moderna. One is advised no younger than 16 and one is advised no younger than 18.
Right, and that's the age is based on the group that they decided to do the testing on. When they did test subjects and injected them randomly versus a placebo, it's what people they brought into the study. So one company went down to people age 18, the other went down to 16. So they were approved for those ages, and
So
yes,
it's based on the test subject.
yes.
Okay.
And then we all know about the differences in the temperature storage.
Well, what is the difference? What would one fundamentally need that sort of refrigeration and the other wouldn't? What causes that?
So as I understand it, and I'm basically going to regurgitate some words that I heard, that I partially understand. Um, the Moderna vaccine, the mRNA. So they're injecting mRNA into you. mRNA is an instruction. So let's back up. We all know that DNA has the code for everything about us, or everything about how to build one of us. mRNA. If I want to make the protein for my eye, for one part of my eye, then I don't need all that DNA. I need one little tiny section of it.
Mm-hmm.
So we make a copy of that, but we kind of translate it a little. It's like we transcribe it. In fact, that is the word that's used. We transcribe it from, let's say, the DNA was all on an audio recording, and now you listen to that audio recording and write down the instructions for that one protein. And you write that down on mRNA. Where was I going with this?
The differences between.
Oh, the difference. So they both are mRNA, and they both are mRNA for the spike protein. Remember your picture, those models of the coronavirus. It's a ball with these little spikes coming out of it.
Okay.
And they are called spikes. And those are the proteins that it needs to use. Those are the keys to get into our individual cells. And without those spikes, it can't get into those cells. So it needs those spikes. And what the mRNA is, the instructions to make those spikes. So the mRNA gets into us, and then we make a bunch of those spikes. Our body recognizes those spikes are foreign, and it builds antibodies to them.
Mm-hmm.
The Moderna mRNA, and this is where I'm good. That's all stuff I know from basic science. This now I'm going to regurgitate the words I hear. The mRNA of the Moderna vaccine is coated with nanolipids. Nanolipids. So I know the word nano means really small.
Mm-hmm.
Lipids are, well, we all know about lipids, cholesterol, whatever.
Right.
So it's coating it with some molecules that apparently protect it so that it can withstand higher temperatures. Those higher temperatures are like minus 22 instead of minus 80. But, you know, I don't know about Moderna, but with Pfizer, you know, one of my medical friends actually thought they were going to inject it into you at minus 80. That isn't what happens. You reconstitute, you get the vial, and then you reconstitute it, probably by adding water. And this is the Pfizer vaccine. You have 5 days to inject it. So they're not injecting super cold liquid into you.
Mm-hmm.
But you have 5 days to inject it. I don't know with the Moderna what's going on or how they do that. What I found out today was that my hospital has been giving the Pfizer vaccine to people, but they're going to switch over to Moderna. My guess is because there's two reasons why you could do that. Because it's easier to handle because of the temperatures, or maybe because there's more of it available.
Or that there's a storage issue.
Yeah.
Right. One thing for me is that why is there a variation at all? Why is there not a consistent formulation between those two companies or any company who's embarking on this creation of this vaccine? It's designed to do one thing, and that's to eradicate the symptoms of this virus. Why is there so much of a variation between the two that there are two different vaccines?
Well,
or maybe there will be 10.
There will be multiple vaccines, assuming any of the others reach this stage. They tried this. They used the same method. They are the same basic platform, but they had different techniques that they used. And you know, we didn't. Who knew that Moderna was going to make a successful vaccine? Who knew that Pfizer was going to make a successful vaccine? One of the things, Operation Warp Speed, is that the name of it?
Right. Yeah.
I mean, that was a great thing. The Trump administration deserves credit for that. That was a great thing. Now Pfizer wasn't part of Operation Warp Speed, but Moderna was. Get a bunch of people out there trying it to do it, because who knows who's going to be successful. So one of my good friends is a very well respected veterinary neurosurgeon. And he told me about what is it? FIP, feline inflammatory disease. And it is a disease that cats get that is a coronavirus. And they've been working on a vaccine for 40 years.
Mm-hmm.
And, when you're doing animal research or for animal diseases, you can do experiments that would be unethical in humans. And they still, in 40 years, they couldn't come up with something.
Well,
So,
you know about dogs. We know about dogs. I mean, we were showing Shih Tzus 20-something years ago. And when we first had our first Shih Tzus became family, there was always corona to vaccinate against. There was always something. Of course, there's a different strain. But corona is not a stranger to our society. It's not. And it does have more of the prominence as far as animals are concerned. So, exactly.
So I was afraid they might not be able to come up with one. I was also expecting it to only be 50 or 60% effective because, often our flu vaccines are only 50 or 60% effective. So, the fact that we have two that are 95% effective.
That's extraordinary.
Great. Now, just to be clear, though, these vaccines don't keep you from getting it, right? They just lessen the symptoms for you.
Well, no, that's not true. There was, I forget the numbers. There was much lower infection rate in people.
Okay.
And then the people who did get infected did not get severe disease.
Mm-hmm.
So, but they are warning that, you say an interesting thing, because they do talk about that they're not sure that it's going to prevent infection, that you may be more likely to be a carrier if you've had the vaccine. I shouldn't say more likely to. And if you get infected, it's more likely that you will be an asymptomatic carrier than if you were infected and not have the virus. You're more likely to be, and if you don't have the vaccine, you're more likely to be symptomatic.
Okay.
So you could be a symptomatic infected person. If you have the vaccine and you do get infected, you're more likely to be asymptomatic.
Gotcha. Okay.
So, wait, before we move from that, I hear a lot of buzz about, well, now I'll get the vaccine. I won't have to worry about this anymore. But the person who's next to you is going to have to worry more, if I'm hearing you correctly.
Yes, so there will be more people. I shouldn't say there will be more.
And I'm worried about the cavalier attitude of, I've had the vaccine, so I don't have to worry about it anymore. I don't have to wear a mask. I don't have to be 6 feet from someone.
You can still get infected with the vaccine. It's less likely you will get infected if you have the vaccine, but you can still be infected with vaccine and you can still spread it as best they can tell. And as I said, my sister got the vaccine today, and she's got to get her second shot. I think she got the Pfizer, and she has said to me she's going to be every bit as careful as she was, and she's basically where I am. We are extraordinarily careful about.
Well, you're also extraordinarily knowledgeable on the medical side of it. And I think a lot of people are thinking this is the panacea, this is the miracle. And once I have the vaccine, I don't have to do anything else ever again. And I would really like for you to dispel that notion if it is dispellable. And it sounds like it's absolutely so.
we're going to still be wearing masks. I will still be wearing a mask after I have the vaccine.
Mm-hmm.
One, because I'm mayor and I need to do it in solidarity with those who haven't had a vaccine yet. But two, because it's the right thing to do, because I could still get it and I could still spread it. And
Mm-hmm.
I'm absolutely, because I'm going to get it before my wife gets the vaccine. I still, when I get home, I'm sorry, sorry for this visual picture, but I get home and I strip as soon as I get home, and I put those clothes in the washing machine,
Mm-hmm.
and I take a shower because I don't want to infect her.
Right.
God forbid I infect her. So I'm still going to do that. One, it could still be on my clothes,
Of course.
and two, I'm still wearing a mask at work because I'm not bringing it home to her.
Right.
And that's the empathy part,
Mm-hmm.
the empathy and delayed gratification.
Mm-hmm. Do you spray your car?
Pardon?
Do you spray the inside of your car
I wipe it down with
or whatever?
diluted Clorox solution. Yep.
Okay.
So I forget which is which. One of the intervals between one of the vaccines is 21 days, and the interval on the other one is 28 days. I just don't remember which one is which. Any I'm sorry.
I don't remember which is which either.
Yeah, but any idea why there'd be a week's difference? I mean, if the vaccines are basically the same.
I don't know. Here's a guess as to why. I wondered that myself. It's probably just the protocol they set up. They probably did some initial testing and showed where when there was a spike, probably in the animals, when there was a spike of antibodies, and they took a guess. I mean, with one of them, I think it was with Moderna, they accidentally found out that the first dose should be a half dose and the second dose a full dose of what they said. I'm going to make up a number. You need 100x of this. The first one should be 50x, and then the second one is 100x. And they did that because they were doing it in two different countries. And in the South American country, they messed up the instructions and they gave the half dose first and then the full dose on the second one. And it's only because of that mistake they found out that the first dose should be a half dose because those people had better reactions than the others.
Acclimating.
That's interesting.
Yeah.
Yeah. So my guess is they had some inclination as to that's what the way to do it, and they probably from some kind of animal tests, and there may not be. You do an experiment 5 times, you probably get 3 different answers.
Of course.
Or slight variance in them, and then that's how they ran their studies. So that's how you got to give it.
Right. So what would be the danger? I go get my first shot and I say, you know what, it's good enough. I'm set. What's the danger of not getting that second stab?
You won't get as much immunity. It won't be as effective.
Okay. And do we have? I mean, the last I'd heard about this, they weren't quite sure how long a period of immunity the shot gives you. Do they have any? I guess they couldn't, could they? It's too soon.
Right. I mean, in a few more months, we'll start to hear what those, the original test subjects, what their antibody levels are.
Mm-hmm.
But even that's going to be, just because your antibody levels drop doesn't mean that you're less protected necessarily, because you have these sentry cells out there that are looking. They've now been trained to look for the virus, and if they find the virus, they swing quickly into action.
Hmm.
I haven't taken immunology for 30 years now, but it's incredibly complex.
I can imagine.
The way it works.
I can imagine. So
T cells and B cells and B helper cells and.
I have a question about: is there someone who shouldn't be taking this vaccine?
Well, they talked about the people who have extreme allergic reactions. People are allergic to many things.
Mm-hmm.
But I don't know if they're going to modify that. I mean, maybe. So if you are one of these people and I don't mean that, you take drugs and you get a stomach ache from it. I mean allergic reactions, rashes, tongue swelling, difficulty breathing, those kinds of things. You need to check with your doctor, and maybe they would pre-medicate you with Benadryl, or maybe they would only do it in a hospital setting. I mean, and I'm making this up, but maybe they would do it where they would actually put an IV in you so that they're ready to go with an epinephrine drip, not just an EpiPen, but an epinephrine drip if you were to have a reaction. And you wouldn't stay there just 15 minutes. Maybe you'd hang around for an hour. Again, these are thoughts of mine as to how you might do it. I don't know what the protocols are. But
well, I think I was also looking for if you would be allergic to this, you're not advised to be vaccinated with either of these vaccines.
I don't know of a particular thing. There might be something out there. I know that just because you had a reaction to the flu shot doesn't mean that you can't have this shot.
We have a comment. It's a rather long comment from somebody who also knows a thing or two about this sort of thing. Mike Smith, who is, as you know, a school board member,
Scientist, right?
Yeah,
and also a
But
scientist,
he's also a scientist, right?
has weighed in, and he says that messenger RNA is a smaller piece of genetic information that is read by ribosomes.
Yep.
Right.
To make proteins. In the case of the virus,
Ribonucleic acid.
in the case of the virus vaccines, the mRNA for both are protected by a lipid bilayer nanoparticle, a sort of synthetic cell wall, to ensure delivery to cells. Once introduced into the human body, a small fragment of the virus, a protein, is made by the human body's machinery. As a foreign body, antibodies are made to fight off actual virus particles if ever encountered. So,
And this is exactly what Dr.
Thanks.
Mayor Kramer was saying.
yeah.
Well, thanks, Mike, because actually I was wondering,
Yeah.
how is the mRNA getting into the cell? The cells have cell walls, and it's not easy to get into them. That's why these viruses have the spike proteins. So what they do is they coat them with a lipid, which is the cell walls are lipids, and it's like two bubbles hitting each other and merging, is what I'm getting from what Mike says. But Mike clearly knows more about the specifics of that. You need to get Mike on. Send him the link. Get him in here. School board member, get him in here.
Yeah, that would be ideal.
He knows some science I don't know. Get him in.
I don't know where he is.
Can you do that?
I don't have his email address or anything, so I'm not sure I can. Or
Well, maybe he can add that to the comments.
if you want to,
If you'd
yeah,
like to be
Michael,
part.
if you would like to join us, Michael, put some sort of email me at editor@franklinreporter.com and I'll just email you the link, and you can join us. I'll man the email. But yeah, so we'll give him a couple minutes and see if he wants to do that. Interesting.
I don't have his number.
Okay. I just as an aside, I was reading something. I don't even know where I read it, but had to do with the last pandemic back in 1918, 1917. And we still have a remnant of that pandemic in the radiators that some of the older houses use, and a lot of apartment buildings in New York City. Those radiators, those metal radiators that blast heat. That was done on purpose, because back in 1918 or so, when those radiators, those didn't exist until that time, because the thought back then was they wanted people to get some fresh air, so they wanted you to have your windows open. But then it was
not freeze.
But not freeze to death. So they created these radiators that blasted heat to make up for the fact that the windows are going to be open, especially in cities like New York. So that's why when you go into these older apartment buildings, you've got these ridiculous radiators that melt you in the wintertime and make you open the windows, because that's exactly what they're supposed to do.
That's the point.
I thought that was fascinating.
Yes.
So some of you reminded me of something that is fascinating. I've acknowledged you. That's it. No, that is fascinating. But so sadly, this week we buried my aunt, who was 103
so
years
sorry.
old.
Sorry.
Wow.
My mother, as I've said number of times as 100.
Mm.
And so I've got some longevity there. But it turns out my aunt was 1 year old during the pandemic of 1917, and she got the virus, and she survived it, obviously, and she lived into the next pandemic.
Wow.
I did lose.
Oh my God.
I lost my aunt Fanny, who was 11, one of their sisters,
Oh.
To the pandemic.
Wow. Wow. So I think if we were to put this in a nutshell, Mayor, is it fair to say your advice would be vaccines, get them, and holiday gatherings, avoid them if you can?
You can only have a holiday gathering if they're giving vaccines out.
Yeah.
One thing that we had talked about earlier that I'd like to mention as a possible concept, the Andrew Cuomo, the governor of New York, was suggesting that the Buffalo Bills football game is going to permit approximately 6,700 spectators to actually go to the game, and how they're going to be monitoring or trying to avoid any spread is that there's going to be rapid testing at the gate and contact tracing information taken and strict enforcement of face masks and social distancing. And my thought is, wow, that sounds like a really reasonable thing to do. And it has broader implications for restaurants and other venues such as concert halls and theaters. And what's your thought about that, Mayor Kramer?
I'm Googling how big is the Buffalo Bills stadium.
I would bet 50,000 people.
Bills Stadium.
Still
71,870.
Wow.
So not even 10%.
So not even 10%.
Right.
So
Right.
So you can be 10 seats away from someone. Of course, then you have the other rows, so you're kind of 5 seats from, if you stagger rows back and forth. So there's some distancing there. Look, I personally wouldn't go.
Well, what do you think of the idea of the rapid testing upon entrance?
The problem with rapid testing is that's what they did at the White House, and I think Governor Chris Christie would tell you that didn't work. I'm
So you're not a fan of rapid testing?
Look, it's better than a full stadium with no one wearing masks and lining up for beer. I'm not sure I would go there. I'm also not a sports fan. I watch the Super Bowl and try to catch one of the World Series games and at least one game during March Madness. That's the extent of my sports watching. So
except for the Franklin High School basketball girls, the Lady
Warriors.
Yes,
That's true. That was exciting.
That was amazing.
But so to me, it's not much to give up. To other people, empathy. To other people, I personally wouldn't go, but I don't care about sports. I think you're definitely taking a risk. And the rapid testing is nowhere near as accurate as PCR testing.
Okay, so that's more the issue. My thought process, as some of you know, I'm also in the music industry, and so many of my friends who do this full time, venues are closing left and right. It's having a disastrous effect on that industry. Broadway is closed. There is just so much that is not happening for full-time musicians and artists. And even when there was not a whole lot of enforcement in the bar scene, let's say down the shore, nobody's wearing masks. Nobody's doing social distancing. Certainly no testing. Certainly no temperature checking. And with this possibility, I think it's one level of screening that has a broader base than just sporting events. And that's kind of where I was thinking it could have a beneficial application. Better than not is totally accurate. I don't know if any of these tests are totally accurate. I had an issue with the saliva test. in that not one person said to anyone beforehand, oh, you probably should restrain from eating or drinking anything or smoking or chewing gum or anything that's going to alter the chemistry of the saliva, because that's going to alter your result. No mention of that at all. So I had a problem with that.
Yeah.
But the rapid testing, at least it is a screening mechanism, and maybe there's another test that's more effective that can be developed to be rapid. But the idea of possibly opening more businesses that can be protected by a testing mechanism and an enforcement of the distancing and the masking and contact tracing. So I just thought it had some promise, was beyond sporting events.
Saturday Night Live did this. They had a live audience and they used rapid testing.
Mm-hmm.
I hope someone collected data and did a study as to whether that was effective
Mm-hmm.
and what the risks are.
Mm-hmm.
So, and if they hope if they bills do this, they do a study.
I'm sure they will.
Mm-hmm. Well, that'll be interesting because it has the germ of possibility. I didn't mean to use that word, so sorry. That was totally.
The Count Basie Theater in Red Bank has a thing called pop-up stage where they've basically put a platform on top of their seats, right? So you've got, now instead of having an orchestra or whatever of seats, you've got just a floor, and then they've put tables on top of that, and they've socially, from what I've seen, socially in the pictures, socially distanced the table. So they're able now to provide entertainment, not to the however many people they were able to in the past. I haven't been in there since 1977, but at least there's, the venue's open. They're providing entertainment, and people are there. People are there live. People there live to watch whoever the comedian is or the act. We have somebody named Naomi Nierenberg. Where'd she go? There she is.
Hi, Naomi.
Naomi Nierenberg says that the football game attendees is for frontline workers. So that's interesting.
Okay. Well, thank you for that.
That's good. Good for that. We have some of the smartest,
most well-informed,
and most well-informed readers around for the Franklin Reporter. Let me tell you.
Yeah, we appreciate that. Thank you.
All right. I think we've covered the topics, have we not? Is there anything there? Have we forgotten anything that you wanted to bring up?
Yeah, there is. So we've been doing an enormous amount of testing in town.
Okay.
I'm guessing we've tested around 12,000 people.
Wow.
Wonderful.
I
thank you for being part of that.
I don't know. I mean, many of the people have been retested, so I don't know that we've reached 12. You understand what I'm saying?
Yes.
I say we've done 12,000 tests because we've done more than that because we've done PCR testing and antibody testing. But you get the point.
Yes.
Mm-hmm.
We've had 12,000 visits, I guess is the way to put it. I don't know what happens if this federal bill doesn't pass for funding, because the reason that they were free, and my apologies, I'll divert a little here. There were some people who did get bills. Please go to my website, mayorkramer.com. If you've ever gotten a bill, if you've ever had to pay, you don't have to pay. These are free. If a mistake was made, then please go to mayorkramer.com, and there's a link near the top that you can get information there, or email me at mayor.kramer@franklinnj.gov. Yeah, franklinnj.gov. mayor.kramer@franklinnj.gov. If you got billed, we will take care of that. But anyway, the reason it was free was because the CARES Act law was, if you had insurance had to pay for it and couldn't charge you a copay. And also the kits, etc., were paid for by the government, by the federal government. So if this bill does not happen, I don't know what's going to happen to our testing program here. I'm very concerned about that. So I hope people don't see that as getting political. I'm not pushing one party versus the other. I'm just saying pass the bill.
All right. Good thought.
What are your thoughts about retesting?
I think I've been tested 5 or 6 times.
Mhm.
If that answers your question.
Well, again, on the principle of the next person you meet could have it, and your test yesterday would have missed that encounter.
Right. Yes. And you know, as I said, my mother's 100. If I go visit her, excuse me, I socially distance. I wear a mask every second. I scream at her when she tries to take her mask off. She's 100 years old. How do you tell her what to do? I don't, when I eat, I go into a different room. Um, you know, so, but I get tested before I go. So at least I know something. Now, again,
Right.
if I got infected 2 days before I got that test, it's not going to come out. So it's not perfect by any means. And so I'm giving in a little bit there, and I will admit that. But I take whatever precaution I can because she's been alone. She's 100 years old and she's been alone
Wow.
since
God bless
middle
her.
of March. And so there's some issues with her house, and I just had to go.
Mhm.
Or otherwise, she would have to move in with other people, and that would be a greater risk. So
Right.
Exactly.
lessening the risk as much as possible.
Right. Okay.
Well, again, I am a proponent of test and retest because you just don't know. You just don't know.
Yeah, and if they talk about these cheap, and I don't know, they're saying $30 to some people. That's cheap. To other people, that's not cheap, especially now with COVID. Home tests that if they could come out with it, that would be very useful to part of our society.
Yeah.
The other thing I'd say, give to the food bank. People are hurting out there. And if you're having trouble with rent, go to the Franklin Township homepage. And in that screen that changes, there's like 3 different slides. One of them is to apply for rent assistance.
Okay. All right. Well, Mayor, Doctor, Your Highness Phil Kramer.
I always want to be called Lord Kramer.
We want to thank you for coming on to the news hour tonight, and as usual, it's chock full of information, and I'm sure that our viewers appreciate it as well. And I know the dog does because he's singing your praises right now.
News hour. I thought this was fun with flags.
Say again?
I thought this was fun with flags.
That's on Saturday mornings. All right, sir. Well, thank you again for coming on. We really do appreciate it, and we will see you soon.
Thanks for having
Yes,
me. It
we
was
will.
fun. I hope
Thank
it
you.
informed someone.
Stay healthy.
We appreciate it. And again, Franklin, if you have any more questions and comments, I'm sure we'll be able to have them answered at some point by Mayor Kramer as we disseminate this further.
So
So
that was a lot. I want to thank Michael Smith for chipping in there on that explanation of the vaccine. That was great.
yes, and for Laura Smith for introducing the discussion of that.
Right.
Thank you, Laura and Michael.
Right.
We appreciate that.
So I guess the bottom line, Franklin, is when the vaccine becomes available, get it. I know that I've read on the county website that they are looking for 70%. 70% of the Somerset County residents being vaccinated, because that's the level where they feel that we can actually have an effect on the coronavirus here in Somerset County. So if you can, get it. I'm not a big fan of vaccinations. I haven't had a vaccine since the 90s when I had to get vaccinated for a variety of things because I was on the hazmat team at NJIT when I worked there. And I have a very, very, I have a very funny story about when I was a little kid getting my shots. We lived on Fort Monmouth at the time, so we went to the Army Hospital, Patterson Army Hospital, and I did not like shots. I did not like shots. So I remember being in the doctor's office, and they're preparing the needle, and I looked at that needle. I said, I noped out of there, man. I ran out of the examination room where I was going to get stabbed, and I'm running through the waiting room, and the waiting room at the time, this had to be like early, obviously it was early 60s. It had those plastic chairs, with the metal frames and the blue and the red plastic chairs, and they're just set up in rows. And I'm jumping over those things. And I've got doctors and nurses chasing me.
Oh my goodness!
In the waiting room, and I'm going under and over these chairs. And when they finally got me, and I wasn't that big a kid. I was a little kid, but it took a couple nurses holding down my legs, and a couple doctors holding down my shoulders.
Where were your parents?
They were. Well, my mother it was just my mom. She was mortified. My dad was working, but my mom was absolutely mortified.
Oh,
and
I can imagine.
And so they're holding me down. And I don't think they don't let the parents in on these things. So they're holding me down while that doctor gave me that shot. And that was terrible, but it was very.
Did he have any teeth left by the time you were finished?
Who, me? Yeah.
No, the doctor.
Oh, the doctor. Yeah. That's one of my earliest childhood memories of. And I was not recently, but several years ago, I took a tour of the hospital before they closed the Fort Town, and I was actually in that room.
Oh,
that was like a blast from the past. But anyway, that's a diversion.
A happy little memory.
Yeah, get the shots. That was a way of me, by way of me saying I'm probably going to get. I am going to get this vaccine because this virus. Not a whole lot of things scare me. This virus scares me. Mm-hmm. When you see and you read about what people are going through.
It's just the unpredictability of it that nobody has a handle
on
how
it's
going to behave.
And even if you get through it, there's the potential of long-term effects. You could have, your lungs could be affected, your heart could be affected. Mm-hmm. They're talking about cognitive issues now, and somebody was blind. I mean,
oh my God.
It's ridiculous because this thing just messes with your body in so many different ways,
right?
And it's very scary. So yeah, I'm going to be getting it, I think. And
as far as I'm sorry. Go ahead.
No, sorry. Go ahead. I'm done.
No, I was going to say I was relieved to have Dr. Mayor Kramer explain that it is virtually impossible for the virus to be transmitted to you via the vaccine.
Right.
Because I do believe that is a major fear. Of course, side effects are a major fear as well. But the common conception of vaccination is that like stimulates like, and antibodies, that in order to have the antibodies develop, you have to have had that which replicates the virus so that you can fight against it. And it does reproduce the virus itself, although it's not live.
Right.
I think that's a big fear busted.
Right. It's not the part of the virus. It's the spiky part. It's not the part of the virus that gets you sick. Right. And the way I've heard it explained is it's like an email. It sends an email to your body, and your immune system kicks into gear and fights it off.
Well, it's also going to be an experiment with those who've already received the virus to see how their bodies are handling it within the next couple of weeks.
Well, I've read that if you've had the virus, you shouldn't get the vaccine for X number of days. I think it was 90 days.
I heard that as well. Yeah, I don't know exactly the day quantity. But those who received the vaccination, it's going to be interesting to see what their experiences are within the next few weeks.
I think there's been some of the side effects have been headaches, a soreness at the injection site. Mm-hmm. You get tired, but it lasts a day. The more severe shocks are anaphylactic shock, which is really severe. I think that's
very severe.
That's happened a few times, but there's been literally, well, I don't know how many, but I would assume by now hundreds, if not thousands, of people have been vaccinated already around the world. Mm-hmm. So if you only have 2 or 3 of those, then you're going to get. Everything has a risk, right? You walk out the door, you have a risk of, somebody throwing poop on you or something. But
which is the greater risk? The risk of contracting the illness, or the risk of doing something prophylactically to prevent getting the illness? So it's I think this was so informative by Mayor
absolutely.
Mayor Kramer. to dispel some of the fear myths
All right.
that I think people who are hesitating are experiencing. Yes, you hear I have quite a cacophony going on. Yes, one is barking on one floor and the other
Everyone's
is
barking on the
one
other.
floor.
That's great.
Because I did close
Good
a
harmony.
door. So,
And as far as holiday gatherings go, I would just say keep within your bubble. And I'm going to be posting in the comments that link that I had up, and I'll put it up again here. This is the link to the CDC document on suggestions on how to deal with family gatherings,
mhm.
and what they recommend if you really have to do it, and if you have to have a lot of people over.
Well, it's not a have to. People are dying. Well, oh God, PJ,
But
not
people
the right word.
really want to
But
be.
people want that contact
Yeah.
with their loved ones, and it's a perfectly natural emotion to want to be close to people.
Of course it is. You can't argue.
So the best we can do, if we're going to be doing that, is to protect each other. It's not just protecting of yourself. Everybody who wears a mask, and mask hoaxers aside, you wear a mask because you're protecting me. I wear a mask to protect you.
Mhm.
The duality of the protection is unmistakable, and it's been proven to have an effect. So why not do it? I mean,
do it.
just do it.
You know, you walk
Exactly.
into a store, you see a sign that says no shoes, no shirt, no service. No one's screaming about their constitutional rights being violated by that. I mean, come on. It's a piece of cloth. Come on.
Exactly.
All right. I
If
think
we all do the right thing, this goes away a
Yeah,
lot
and
faster,
you know,
folks.
we want to have fun come spring and summer next year. We don't want to have to deal with these lockdowns and all this other
Mhm.
nonsense.
And
So
more importantly, we don't want to lose anybody
Right.
else.
exactly.
I mean, we both know people in this community who we are stunned we lost.
Yep.
I know 10 people, including a baby.
Yep.
It's insidious. It doesn't know race, age, skin color, racial profile, or religious preference.
Or your
It
politics.
knows nothing. It is inanimate until it gets into you. So
Yes. So we're going to end this with a comment by Laura Smith. Great job. Thanks. Get the vaccine.
thank you, Laura, for bringing that very, very timely and important subject up so that we could discuss it. Thank you so much. And thank you, Michael.
Absolutely. All right, Franklin.
And thank you, Mayor Kramer.
And thank you, Mayor Kramer, for agreeing to come on with us to talk about this. So, if you want to get a hold of us, you can email me at editor@franklinreporter.com. If you'd like to talk about advertising,
Which we would like to talk to you about.
We want to talk to as many people as want to talk to us about advertising. You can reach the director of advertising, who happens to be PJ Parker, at ads@franklinreporter.com.
And if I could say just something real briefly about that, there's a lot of talk about, well, you know, when things are down, people could cut back their advertising dollars. Well, you don't want to be appearing as if you're not around. Your promotion still needs to say, we're here,
Right.
and we're strong. We're struggling, but we're still here.
Yep.
Patronize our business.
Right.
Without that visibility, you have less opportunity to outreach to the community. And lest I say this, we're a pretty good source for what's going on in Franklin Township via the website, via the daily email of the day's top stories, and of course the monthly paper that's direct mailed, as well as at many drop-off locations, including Stop and Shop and ShopRite and Wawa and 7-Eleven and a few other places that it keeps you informed as to what's going on. So you might as well piggyback your business to the interest that people have in the news of their community, of their backyard. So
absolutely.
and we've just instituted opportunities for those of you who would like to sponsor our news hour like this. It's an additional exposure out into the community and an alignment with the Franklin Reporter and Advocate. That's also available on any of the charitable live streams that we do or new business openings that we do. So we're here, Franklin.
Yes.
Our mission from day one was bring Franklin to Franklin.
Absolutely.
And that's
Yeah.
That gives us great joy.
Absolutely. And as usual, if you want to see what's going on in town, you can always go to franklinreporter.com. We're also on Twitter at Franklin Editor, Facebook, Franklin Reporter, and Instagram,
Instagram.
Franklin _reporter _ advocate. You type that in once and your browser will remember it.
Right. Cut and paste.
Yeah. All right. Well, hello. That's a dog saying, "Feed me, I'm hungry." That's going to wrap it up for us
That's a dog
for
who
the
is
December
now
23rd,
perched into
2020 issue of the Franklin Reporter Advocate News Hour. The show's going to the dogs, folks.
He must see a moonbeam.
Yeah, exactly. All right. Until we meet again, Franklin Township, as usual, you stay safe. PJ, say that thing you always say.
Well, I'm also going to say, for those of you who celebrate Christmas,
Ah.
have a blessed Christmas. Be safe, Franklin. Enjoy your loved ones. Just take care of them so they're here with us next year.
Right. Okay.
Merry Christmas.
Merry Christmas and Happy New Year, Franklin, if we don't see you before then. Here we go.